We have the next speaker, Smriti. No, sorry, we have a message from Dr. Megan Doherty, who is a consultant in palliative care in WHO Geneva, a very good friend of Nepal, who has helped us in many ways to develop palliative care. So we'll listen to her message.
Good morning and welcome, friends, colleagues, and special guests. I'm so pleased to be able to share with you from the work of WHO as it relates to palliative care. WHO is pleased to be able to support efforts by countries and regions to integrate palliative care into health system planning. My name is Dr. Megan Doherty. I'm a palliative care consultant with WHO in clinical services and systems in integrated health services. We know that there are significant gaps in the need for palliative care worldwide. More than 60 million people need palliative care, and yet less than 14% are currently receiving it. And the way that we are going to achieve universal health coverage is through ensuring that all people have access to the services they need when and where they need them without financial hardship. And this coverage we know must include palliative care. We know that without palliative care, there is no universal health coverage. And we know that the way to achieve universal health coverage is through strong and comprehensive primary health care, which must include palliative care. I want to recognize the 2014 resolution of the World Health Assembly, which guides our work at WHO. This resolution on strengthening palliative care specifically emphasizes the importance of primary care, community and home-based care, and universal health coverage. A few key points from the resolution include the importance of access to palliative care which is equitable, regardless of age, diagnosis, or geographic location. Secondly, the importance of integration of palliative care into health systems, predominantly through primary health care, and that palliative care should be integrated with curative and preventative services for many conditions. And thirdly, the importance and the need to train and build capacity among the health workforce. When we think about putting this resolution into action, we're guided by a number of WHO documents, but particularly this document, produced in 2021, talking about assessing the development of palliative care worldwide, a set of actionable indicators. And when we think about assessing the development of palliative care in a particular country, we can use this set of indicators to guide us. And the indicators are grouped into what we call this house model, which you can see here on the right-hand side. We think about the key components being empowering people and communities, health policies. These are both illustrated in green, as you can see. Above that, we have research being a key component, the use of essential medicines, particularly opioids, which sometimes are very difficult to access, the importance of education and training, particularly for the health workforce, and all of this together creates a house that supports, in the middle, people with palliative care needs, and the roof of this house is the provision of palliative care through integrated health services. As part of the work of WHO to practically think about how we support member states in increasing access to palliative care so that we can accelerate progress on universal health coverage and strengthen palliative care across the life course, we're focused on two key areas. One is supporting practical integration of palliative care into health systems. And I'll tell you about a palliative care reference package that explicitly defines the health services that are needed to provide palliative care. And secondly, we're developing products to support training of health workers so that they can provide high quality palliative care within the work that they do, particularly in primary care. This online universal health coverage planning tool is called SPEEDI, which stands for Service Planning, Delivery, and Implementation. This tool is freely available online and anyone can access it, and we highly encourage you to check it out later. On this website, we can plan packages for different types of health services, and most notably, we can plan palliative care services and how they can be implemented. I'm going to show you more in the upcoming slides. If you'd like to check out the tool right away, you can scan this QR code. The reason that it's important to have a palliative care package is since we know no country or health system can provide every possible health service to everyone who might benefit. Instead, the use of the Speedy tool allows the prioritization and the selection of health services. Health packages are not only useful for planning services, but they can also be used to help define health worker competencies. Again, that can then be linked to training, medications and devices that are needed to provide services. The package and the Speedy platform can also be used to monitor programs and generate reporting about what services are being delivered and support models of care. Particularly, the WHO Palliative Care Service Package for UHC supports countries to consider key palliative care services as part of a UHC package. The services that you'll see in the Speedy platform when I show them to you in the next few slides are the key services that would be used for first contact health workers. These could be universally available. It's a comprehensive set of palliative care services, and it is feasible in low resource settings. And these services meet the population's needs across all life stages. So here are the 3 core palliative care interventions which are included in the Palliative Care Reference Package for Primary Care. Identification and assessment of palliative care needs, coordination of palliative care needs, and management of common symptoms in palliative care. You can see that we have a number of actions. If you click on one of the interventions on the website, you will then have a drop-down list of actual actions. These are specific tasks that health workers can do to provide palliative care. As an example, one of them is listed here, education and counseling for the patient and/or caregiver. And the green dots on the right-hand side allow countries to map where this health service will be delivered. In this example, there are 5 different locations within the health system where the service could be delivered. COM stands for community, then there's pre-hospital, outpatient treatment, first level referral hospital, and second level or tertiary hospital. And again, health system planners can select where a particular service can be delivered, and then think about how would the health workers who work at that facility need to be trained to be able to deliver the service. Let's look at an action such as oral opioids. This is part of the symptom management intervention. Here, if you click on the actual action, you can see a drop-down menu appears, and here it identifies what is the task that the health worker would need to do. In this case, it's prescribe medication. Over on the right-hand side, we can identify which type of health worker can actually do this task. And again, countries can customize this based on the types of health workers they have and the roles that they are able to fulfill. Because this is a task linked to a medication, the medication is listed here, and it's a link because it links directly to the essential medicines list of the WHO. And then additional data is here, including the life stage and the age where this is relevant, and a reference to where this was drawn from. As I've mentioned, this essential package also connects to all of the other WHO databases of medicines and medical devices. Most relevant for us in palliative care is the EML, or Essential Medicines List. A second key area where WHO is supporting member states is education of health workers and health system planners to improve the quality of care and build capacity to deliver palliative care. So let's look at that item specifically now. Over the past 11 years since the resolution was passed, a lot of palliative care guidance has been produced by the WHO, including some of the documents you see listed here, although these are only a few of many. The challenge is, as we move into a focus on primary care, the number of guidance documents becomes very large, and health workers have to somehow take all of this knowledge and apply it day to day with every patient that they see. We also had one key document from 20 years ago, which was the Integrated Management of Adolescent and Adult Illness, which you can see here. And this actually had a complete module on palliative care that was part of the manual. These were printed and available in many primary health centers and were also available as a digital PDF. Now, 20 years on, we'd like to take all of this high quality evidence, revise it and update it with anything that's happened in the past 20 years and been published, and take it into a form that is mobile friendly. And so all of this work is nearing completion. We have now an app which is called IMPACT, Integrated Management of Primary and Acute Training, and it will very shortly be released by WHO, and it will bring all of the guidance documents and evidence together into one place in the palm of your hand in your smartphone. The app will walk health workers through different areas to consider in terms of assessment and management of patients. You can see some samples of the design here, and I'm very excited to be able to show you a sample of the beta version of the app with some palliative care content that was just developed last week. So you can see what it will start to look like when it's in the app. The app is intended for guidance in the moment when health workers are seeing patients, and can also be used for training purposes. Health workers can read and review the information, and this coaches them through how to manage a particular problem. Lastly, I'll mention the new WHO Academy platform, which is the online learning platform of the WHO. This was launched in December of 2024, and we're very excited to have this available. This is freely available. Anyone can make an account and join. And there is a very useful course on here on palliative care, which you can see shown below. Palliative care, models of service delivery, and symptom management. And this was produced by the Southeast Asia Regional Office of the WHO in collaboration with NCD Care. There will be an additional module on palliative care, which is coming, which is on palliative care health services planning, and this will be available in the next few months. So I want to thank you for your time today, and I wish you a wonderful day at the conference. I very much wish I could be with you. Nepal is very close to my heart at all times, and I hope that this provides you with some insights into the work of WHO. Thank you very much.
I think we need to thank Megan for this presentation, and also for her readiness to help develop palliative care in our country from the very beginning.